My client is a kabaddi player. He suffered an ankle injury during his practice. He is young and a very aggressive player of his team. When he started the rehabilitation program, he was adherent, but slowly there was a change in his approach and became more and more irregular to the program. Why there is change in this approach? How do I address the change in his behavior? If you are such a person looking for answers for such questions, then you are at the right place. Welcome you to this module on NPTEL offered course on Essentials of Sports Injury and Rehabilitation. The module is on psychological aspects of injury and rehabilitation. And I am Wing Commander Dr. Chandrasekhar Guru. I am a sports medicine physician. I am an assistant professor in the field with the Armed Forces Medical Services. So I shall be covering the week 8 of this course on Essentials of Sports Injury and Rehabilitation. You will be learning during this module on various psychological models. What are the various psychological factors that aid in injury prevention? What are the different aspects that are important during rehabilitation and return to sport? What about various psychological interventions that can be done during the process of injury prevention and rehabilitation, and certain practical considerations? So, we know that sports injuries have a wide spectrum. The sports injuries can happen with varied epidemiological features with respect to professional athlete, with respect to a recreational athlete, and with respect to leisure athletes or weekend warriors. There may be change in the pattern between the gender of male or female, or also because of specific sports played and as per the participation rate. So these are various factors which determine the sports injury prevalence and incidence in athletes. Based on the type of sports injuries, it can have at both the extremes of minor impact or major impact. The minor impact may be certain period of training loss, problem because of the physical injury, some quality of life issues. Whereas if it is on the other side of the spectrum, if it is of major impact, it can cause a stop to the sports career. It can also prevent someone from participating in a crunch or an important competition, and it can also have financial implications. So such are the ramifications of sports injuries, which definitely has psychological impairment in addition to physical impairment. So why psychological aspects? As we have discussed in previous modules, Colonel Anup Krishnan and Lieutenant Colonel Atul would have covered all these topics with respect to the sports injuries. However, the sports injuries, the motto of treatment and management of sports injury would be to provide rehabilitation in phases and return at the earliest, as early as possible, to the return to sports of the athlete. In addition to that, you also need to have a comprehensive injury prevention program so that the injury doesn't occur. The psychological aspects play a major role in this entire process, starting from the prevention of injury, occurrence of an injury, various rehabilitation processes and phases, as well as in subsequent return to sport and long-term prevention in terms of the severity of the injury and the loss of function. And this determines also the quality of life of that particular athlete who has sustained injury. It also has ramifications in terms of financial burden. It may be directly on the individual or on the family or on the federation or the sporting organization. The career opportunities may be at stake, starting from an individual who is representing an organization, or it can be a student athlete who is looking for more opportunities. There may be life stress events which also can have an impact on the entire process. Life stress events may vary, starting from personal issues to professional issues to athletic issues and social issues. There will be definite time of training depending on the type and severity of the injuries. So this also can have a major psychological impact. More so is the social support. So let's drill into various psychological models which have connected the factors that would be playing a major role in terms of all these aspects of sports injury and rehabilitation. So the sports injury prevention and rehabilitation have various models that has been proposed in the literature. Few of them to quote are stress and injury model, biopsychosocial model of injury. We have the integrated model of psychological response to sports injury and rehabilitation. Various models with respect to stage of the return to play, models, as well as certain generic motivational models. Let's focus on certain models in details, which is of very important aspect with respect to the sports injury and rehabilitation. The first one is stress injury model. So in this model, what we see is that individual's personality has been attributed to cause certain type of stress response. The stress response probably maybe because of the way the athlete appraise about the situation and thinks over it. It's called as cognitive appraisal, and which can in turn result in an physiological or an attentional change, which can in fact affect the performance of the individual or can result in injury. In addition to the personality, there may also be life stress events just immediately before that particular sporting event. Life stress events, as I discussed earlier, might be personal or can be academic or professional as well. And also depending on the individual's coping resources based on the past experience, based on various techniques that the individual has learned over a period of time, the stress response can vary. So all these three can also have an interplay between these factors. And with such a scenario, exposure of an individual to a potentially stressful sporting situation, like a current situation, like you are facing a qualifier competition as an international athlete to Olympics. So that's a potential stressful sports situation for a Olympian. So that is important for that athlete to clear and qualify for the upcoming next Olympics. So that's the kind of stressful situation that sports event can itself can become. In such a situation, with the interplay of these psychological factors, they may be that may result in occurrence of an injury. So what this model proposed that intervening at this junction to modify the stress response can help in preventing the injury. Thus, this predominantly is the model used for using in terms of psychological interventions to prevent sports injury. Moving on to the next model. So this model says that there are three different factors, namely the biological factors, which corresponds to the tissue healing per se, and the various other physiological aspects that contribute to healing of that particular injury. The second factor is the psychological factor. Psychological factors, as you are aware, it pertains to the personality, the way the individual thinks, the beliefs, various emotional responses the individual can have, and the behaviors. These are all psychological factors. In addition, it also says there is a third domain of factors which contribute, that is your social and contextual factors. This is the social support that the individual have during the particular situation. So accordingly, the model is named as biopsychosocial model. So what it says that this particular model is mainly towards the injury rehabilitation process, not for the injury prevention. In the injury rehabilitation process, based on the injury characteristics, the and the social demographic aspects of that particular individual, the interplay between these two factors can have major effects on these three factors. So the injury characteristics would be the type, the severity, the location, and the cause or the mechanism by which the injury has happened. Whereas the socio-demographic factors would be the age per se of the individual, the gender, maybe male or female, the type of race and the ethnicity the individual is, and other the socioeconomic status of the individual. So these all form the cluster of socio-demographic factors. The interplay between these two factors can influence the biological factors, namely the tissue repair, the kind of metabolism that happens around the injured tissue, the sleep cycle of the individual, the nutritional status can be affected, as well as the immune function of the individual. So biological factors pertains to all these aspects related to the injury healing or the tissue healing. They also can influence the psychological factors. The psychological factors here would mean the personality, the cognition. Cognition is the thought, the way you think, that's cognition. Then the emotion, the way you feel is called as the emotion. And then the behavior. Based on these two aspects, how you act, the way you do, what you do, that would be called as the behavior. So these are the psychological factors. And also the injury characteristics and social demographics can influence the social factors as well. Social factors would mean the support that you enjoy with your close ones, like your parents or your friends, the support from your coach, support from your administration, as well as from your fans. So that forms the social support. The situation, contextual factors can also be determined by these two domains, as well as the environment, the rehab environment post injury, how the environment can support you in terms of getting back to sport. So these are various factors that can influence the outcome of the rehabilitation process. So this also can affect the intermediate outcomes in terms of the various motor qualities, like the range of motion that determines the flexibility, the strength of the muscle, the endurance, cardiorespiratory fitness, and the joint laxity. So these all factors would collectively determine the rehabilitation outcome per se. And psychological factor can directly have a role in kind of addressing these outcomes in terms of quality of life, the rehab adherence of the individual, the treatment satisfaction of the athlete per se, as well as the functional outcome that you are looking at. So that's the way this particular model explains the interplay between the biological factors, the psychological factors, and the social factors in determining the sports injury rehabilitation outcome. Moving on with the third model, we will discuss this third model as the final one. This third model further amplifies. The previous model was more concentrated towards the biological factors, the psychological factors, and the social factors. So it was not dwelling in detail about the psychological factors, whereas in this particular model they try to incorporate in detail about the psychological factors in addition to these other factors. Broadly, the model starts with the personal factors. Personal factors includes your personality, the socio-demographics, the pertaining to the individual, and the the rehab adherence and other aspect. Now the situational factors would mean to the kind of sport specific level that the individual is playing in, the kind of social support that he gets or he or she gets, and the environment, the rehab environment forms the situational factors. These both factors influence the way the individual thinks, that is the cognitive appraisal, how the individual appraises about that particular situation. So that broadly depends upon the individual's own beliefs and past experiences and various coping skills that he already possesses, based on either past experience or based on some psychological counseling or some kind of learned techniques. So this determines the way how the individual feels about the situation. So that is called as the emotional response. The first step would be how you appraise a situation, that is the process of thinking or thought process. Then thereafter, based on the thought process and the belief that the individual has, the individual feels the situation as emotional response. The emotional response may be anxiety, it can be fear, it can be aggression, it can be frustration, It can be kind of optimistic, a positive mindset. So these are the various emotional response one individual can feel. Based on what you feel, you actually act or react to the situation. So that is what you call as behavioral response. So this can be kind of adherence to the treatment. So based on the positive aspect of from the environment, from the way you feel that you will be coming back early to the sport, returning back early to sport, your the way you behave towards the rehab program changes. So this particular model explains you the answer for the first question that I started in the first slide, that is the what determines the change in the behavior. So this is what these models gives you the answer for what are the factors that determine the change in the behavior. So it is not a fixed static component, it is more dynamic. So it keeps on changing based on the changing situation, changing various factors with respect to the personal factors or the situational factors and the way the individual perceives and acts based on the appraisal of the situation. So that determines the recovery outcome. So let's focus on the psychological aspects with respect to injury prevention in this particular session, wherein injury prevention model definitely as a component in terms of the psychological factors. So the model, you would have gone through this injury prevention model earlier in the various modules covered by the other faculty. So as per the model, psychological factor is also an important internal risk factor that contributes or predispose the individual, predispose the athlete to injury. So that's the initial stage when presence of certain psychological factor predisposes an athlete to sustain injury with exposure of the situational factor, that is the sports specific situational factor. So the stress injury model, we just saw that, which is given, proposed by Brewer, which says that the psychological factors broadly are divided into personality factors, life stress factors, and the coping resources. So it is important to target all these three domains of psychological factors if you want to prevent injury incorporating the psychological aspects. In fact, various research studies have proven that with psychological intervention, there has been an increase in the prevention of certain injuries, and this shows the importance of psychological or handling the psychological aspects during the injury prevention program process per se. So let's say dwell in detail, say like using the stress injury model. Let me explain this using this. We have seen that personality, the life stress, and the coping resources have kind of interplay between among them, and they influence the way the individual responds to a stressful situation. The stress response. So the stress response initially involves the way how you perceive the situation, and then in response to the perception or the appraisal of the situation, your body acts accordingly. So it may be in the form of emotional response, or it may be in the form of a behavioral response. But then this also can affect your performance as well. So when exposed to such a critical sports situation, this kind of stress response can cause injury, and we focus on preventing this injury using this model. So let's see the different factors that are under these three domain. The let's focus on the personality per se. Personality factors has certain characteristics like type A personality, where the individual is aggressive, hard driven, and then is more into perfection, and is very kind of impatient in terms of achieving the goals. So this is attributes of type A personality. In such individual, the stress response will be different. So they tend to have more chances of injury. The other factors are those who have competitive trait, anxiety features. You all must be aware about the two different types of anxiety: the trait anxiety and state anxiety. What do you mean by that? Trait anxiety is because of by birth or by naturally the individual has certain traits, we call them as traits. So because of the innate trait personality and the kind of development of the nervous system, the individual has anxiety to competition whenever exposed to a competitive condition. So that's termed as competitive trait anxiety. Whereas state is defined based on the situation. The type of response the individual has, the anxious response, it is only present when the individual is exposed to certain situation. So that determines the state. So this is okay, where you can address, you can modify or train the individual to face the situation, but then here the response is more innate. So generally they have predominant response in this group of people. So these type of people who have competitive trait anxiety, also those who have a negative mindset, you will find a situation progressing in different outcome based on the mindset as well. Say for example, you are trying to go to office on time. Before going to office, been looked after, you get ready, you find your things in place, you get ready for the office, and then you move with a smiling face, seeing of your friends, or you're seeing of your wife or your husband or your parents, and then you leave to the office. So the outcome there at the office might be very pleasant, and you will be able to feel a cheerful mood in your office. Whereas imagine a situation where you start the day with a kind of lethargic mood, you don't want to go to office, so called the Monday blues you can say, and you're not slept well the previous night, you are in a kind of irritable mood, you couldn't find your watch to wear, you're looking for it, and then you have a altercation with your spouse, and you leave to office in a negative mode, and you miss your bus, and further you take a cab and then reach the office where you are delayed, and then you get told by your boss and the colleagues. So that creates a kind of a different outcome. So it's the same you, but it's the mind space, the negative mind state actually determine the outcome. So these type of negative mind states like anger, mood disturbances can also affect the stress response and can cause injury. So these are the type of factors that one need to understand with respect to the personality factors. What about the life stress events? Let's kind of delve in detail. The life stress events probably would be social, personal, academic, can be financial, can be athletic related, or it can be professional. So let's say an example of social. Say you're a very famous sports celebrity, and you have huge fan followers in your Instagram or your social account. Okay, so you have millions of followers. You make a frivolous remark, and then you suddenly see the next day when you get up, some 10 thousands of followers have kind of uh, 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 moved away, unfollowed you from your or in your, from your social handle. So that sometimes also creates a kind of stress in you, the way you see at that event. So that's one of the example that you can quote as a social kind of life stress event that can happen. In other terms, in pertaining to the playing scenario, you can say that your coach was always very supportive to you, finds after a certain event that you are not very keen in kind of learning, and then he is not supporting you in certain kind of tasks. So that itself creates a kind of stressful situation in terms of the social support that you gain from your coach. So that's a life stress event. So the life stress as a broad category, it can range from minor event to a major event, but then it is how the individual appraise the situation. So totally it is individualistic. If it is a young athlete, a student athlete, obviously for him, coach not kind of displaying the same kind of rewarding and affectionate approach would have a major kind of impact on the student athlete. So has the kind of impact that can happen depending on the individual's appraisal of the situation. A family related personal life stress event may be a breakup in the romantic relationship. It can be as huge as kind of losing a close one in an accident. That can have an impact on your psychological the way you appraise the situation. So these are various life stress events. Then the third one is the coping resources. Coping resources is what I already possess in me to handle a situation. So the coping resources would mean would be kind of based on the past experiences. If I am a seasoned athlete, an international level athlete, obviously even though I have competitive anxiety, since I have hold experience of participating in competition, I can manage. I know already with the past experiences how to handle the situations. I know that it is like kind of uh, short term, and I would have already learned certain techniques to control them, to focus on what is required at that point of time. So that's called as the stress management techniques. So those things you would have already learned. Then these forms the broad umbrella terms of coping resources. So the interplay of these three can determine your stress response. So the intervention or the psychological intervention that needs to focus is to address this stress response. So if you are able to address the stress response using any of the psychological intervention, you can prevent the occurrence of the injury. So let's discuss this model. It's more of a theoretical model, but then we can apply it to our clinical and day-to-day sports practice as well. So let's see it with an example as a case scenario. Let me read out for you. Ankita is a gymnast from Delhi. She used to get anxious before the competition as an athlete. Okay. Recently, she had experienced a bitter breakup of a romantic relationship. She is competing in a national qualifier against fierce competitors in Chennai, where she had never been before. So this time around, a father who used to be an ardent supporter could not turn up because of some official commitment to this particular competition. She deeply thinks about the importance and the magnitude of this competition and was feeling completely stressed out. She could not sleep well the previous night. During the competition, her heart rate was so high and she had palms that were so sweaty, and she was feeling tightness of the entire muscles of her body. During the performance of overvault, she became very nervous and landed on the outer aspect of her left leg and resulted in a grade 2 ankle sprain. So, this is the situation. Analyze this particular situation based on the stress injury model which we discussed just now. So, let's analyze this case. So, Ankita is a 17-year-old gymnast. So, this gives you a clue that she is a young athlete. Okay, and she is a female. So this is the personality or the social demographic character. She is a young individual and she is a female. She used to get anxious before the competition as an athlete. So this gives an idea that she may or may not have, but she definitely has some competitive anxiety. So that's why she used to get anxious before the competition. So that's one of her personality factor attributing to psychological aspect. And recently she had a bitter breakup with a boyfriend. So this gives a clue that she had a life stress event in the recent past wherein there was a breakup in all the romantic relationship. And now cognitive response is that the individual now is attending to a qualifier in a new place, Chennai, where she has never been before. Second thing is a father who used to be always be with her during the matches could not accompany her because of some official commitment, so she father could not attend. So there is lack of social support. So this is the cognitive response. So in such a scenario, what she does, the stress response that she had is that the cognitive appraisal is that she becomes worried about the uh, competition per se, thinking about the importance and the magnitude of the competition where she has to definitely win to get qualified for the nationals. So this creates kind of worry and fear in a cognitive appraisal pathway. And she also, because of this cognitive appraisal, she has certain physiological response. So they say that her sleep was disturbed the previous night because of this overthinking. She couldn't sleep well. We all know that a proper 7 to 8 hours sleep in quantity and a good quality sleep is required for you to have good reaction time, for good balance and motor performance, right? So the previous day of the important competition, she couldn't sleep well. I agree, certain amount of stress will be there, which would affect the sleep, but then improper irregular sleep will definitely affect the motor performance. So she has because of the cognitive appraisal, she have had physiological response in terms of sleep disturbance. And because of the competitive anxiety that she has, that has increased the sympathetic drive, resulting in increasing in the heart rate, increasing in the muscle tension and sweating peripheries. So these are all the uh, physiological motor responses that has happened. The cognitive anxiety has got converted into somatic kind of manifestation, wherein the various organ systems are targeted. The stressful situation here would be the qualifier. So it's an important match where she has to compete and qualify for the nationals. So that becomes an potential stressful sports situation. Moreover, she also found that her competitors were equally good and they were in fact better than her. So the fierce competition also adds on to the stressful situation. However, because of the lack of proper attention during the motor performance, probably because of poor sleep, probably because she was not in a positive frame of mind, probably she didn't have a proper social support, that she landed up on her outer aspect of the foot and injured the left leg. So that's how you kind of fit in various factors in a stress injury prevention model. So various psychological interventions that have been used in literature for injury prevention are cognitive behavior therapy. Cognitive behavior therapy is generally given by trained psychologists, wherein they try to target the way you think. So it's basically restructuring of the cognitive pathway, so that you think in a different way. So that includes various sessions for the psychologist to address and train certain the cognitive appraisal techniques actually. The second one is the mindful technique. Mindfulness is a process by which you pay attention to each and every detail, uh, so that your attention and focus improves during the process. Imagery is a kind of a simulation technique where you try to simulate all the simulate or recreate the situation, closing your eyes, in kind of invigorating all the type of senses that is involved in performance of the task on ground. So that is kind of a more of a simulation technique where you go into each and every detail more vividly. So that is also shown to reduce the kind of or modify the kind of stress response that one can have. Stress management techniques, which I had earlier mentioned, is a group of techniques to address the anxiety symptoms that the individual possess. You also have various muscle relaxation techniques. So earlier I said that the way you think can result in tight muscles and all. So if you it's also shown that when you relax your tight muscles, that also can influence in allaying your anxiety levels. So thereby your attention to a task will improve. so that you don't get distracted by the peripheral distractors. And another important aspect is the attention training itself, more of a mindfulness and the way you pay attention to the task which is at hand, and also in the meanwhile have some divided attention whenever it is required and shift the attention as and when that is necessary. Self-talk is again an important intervention that coaches follow on ground, wherein you would have seen in various important matches where individuals speaking to themselves. It's a better way. They say that before going to the venue or the arena, you speak to yourself in front of the mirror. You boost yourself with positive aspects, keywords. Thereby, you boost your mindset as such, and you venture there with full of energy and enthusiasm. So that's one of the method that you commonly see in most of the on-ground practices of psychological intervention. And obviously an important aspect here is the improving the social support. So improving social support in terms of from the coaches, from the colleagues, from the audience, that also boosts up the morale of the individual at that particular point of time while facing the situation. So the research studies have proven that preventive psychological intervention should focus more on the cognitive aspect, and the timing generally should vary from 1 to 6 sessions, and each session should last at least up to 60 minutes, so that you find the individual's exact requirement and address the issue, and carried over 7 to 12 weeks. And these are generally incorporated as part of their microcycle, and they are found to reduce injuries and also to decrease the time loss from training as well because of injuries. So let's see another case scenario. So is Mr. Nilesh Patel is a decathlon athlete, and he is very dedicated and disciplined. Recently, he did not fare well in his college exams. His parents were furious on that, and they were worried because he didn't fare well in the exam. However, he also has a Khelo India University Games to qualify. Obviously, naturally, it's there. He seems worried about sparing more time for sports practice and qualifying for the games. And he also has history of previous injury to his thigh during sprint. So, if the question arises is, what psychological steps will you take as a trainer to prevent injury, considering the dilemma he is presently facing? So let's analyze this as personal factor of a strong proven factor of previous history. The previous history of injury is there. He definitely has an academic life stress situation. College exams are there, for which his parents are kind of worried for that. So obviously he has low support from his parents for the concentration towards the games. That's a social factor. University games is the potential sports specific situational stressful situation, and he's a type A personality, so that's why he's been dedicated and disciplined, able to manage both games as well as his studies. The cognitive appraisal part is that the individual is worried that whether you will be able to spend time for adequate practice and qualifying the games. The interventions that would suit here, as per me, would be social support. Obviously, you will have to speak with their parents, make them understand, or probably if they can also kind of give some support, also speak with the athlete so that he can give some amount of time towards his academics as well, and give some motivational advice as a coach to the individual so that he get boosts up. Goal setting is important here. Another important psychological intervention that I would undertake, wherein break the entire goal into small minor milestones and then give them as part of goal setting, and that could be achieved over a period of time. Cognitive behavior therapy, if you have a psychologist support, where cognitive behavior therapy can be instituted in this individual, and also teach some muscle relaxation technique to improve the coping resources. Probably a progressive muscle relaxation or a breath control technique can be taught in this case. So to summarize this, we saw what are the reason in sports injury and rehabilitation for the various psychological aspects to be considered. We saw about various psychological models. We dealt in detail with the stress injury model, the psycho and social model. We saw how the integrated model, kind of integrated the personal factors, the social factors, and the key psychological factors of cognitive appraisal, the emotional response, and the behavioral response. We also dealt in brief about the various psychological aspects in terms of injury prevention with certain use case scenarios, and applied the stress injury model in this case. And we briefly went through certain psychological interventions that are commonly used to prevent injuries. So, for those of you who are interested in in-depth learning, can refer to these resources at your leisure time. Thank you.